beginning with the spotters, a few instructions for the students. I'll be running the slide of spotters, like 20 spotters in first set, and each spotter will have, like, you will have 20 seconds time for each spotter. Okay, and then I'll be changing the slide. So during this time, you're not going to write your answers in chat box. Okay, students, you have to take a sheet of paper and then write the answers in a sheet of paper. Okay, and then after that, while discussing, I'll ask for the answers, then you can write in the chat box. So this is one thing, and please make it a note to attempt every question. Okay, whether you know or not, you start thinking, because that will stimulate your mind to get out of the comfort zone and start thinking. Okay, if you know the right answer, that's okay. Okay, you write the proper answer. You if you don't know any spotter, you just write modality or the finding or the side, whatever you are able to see, and write. You start writing. Okay, because that's how you stimulate your mind to start thinking and start attempting the spotters. Okay, so you should always get out of your comfort zone, and if your answer is right, then you will feel happy. Yeah, my answer is right. If your answer is not right, but still, it is okay to get uncomfortable. Okay, so if you want to be successful in life, you have to be comfortable being uncomfortable. Fine. Okay, now I think with this warm up dose of motivation, we'll start with the spotters. So, ladies and gentlemen, fasten your seat belt and ready for the takeoff. So, this is first spotter. I'm running the timer here. So, for every spotter, we'll be having 20 seconds. Second spotter. Third spotter. Fourth spotter. If you don't get the answer in a single image, look at all the images. You might get some idea about the answer. Then make it a complete answer and write. Fifth spotter. Sixth spotter. Focus on the marked area. Seventh spotter. Eighth one. Ninth spotter. Look at all the organs. Are all the organs maintaining their shape, the expected shape, or is there any change in here, change in the present spotter? 10 spotter. 11th. Look at both the images, correlate the findings, and come to a final diagnosis. Next spotter. Think of all the conditions giving rise to this finding and try to differentiate why not that, why a specific finding is there in this spotter to come to a final diagnosis. Next one, look at the image carefully. Is the contrast filling properly everywhere or is there any abnormality? Next one, next spotter. Next spotter. Are all the structures in the image com- properly opacified, properly distended or not? Next spotter. I want the name of the sign or line in this. Next one is filling of contrast fine everywhere or is there any abnormality? The last spotter for this set. Look beyond what is seen in the first look. 3, 2, 1. Okay, we are done now. So let's start with the answers. Now, the chat box is open for discussion. Start typing, students. What do you think this is? I will not display the answers until and unless I see the answers in the chat box. Very good. It is. Who answered? Abhishek. Abhishek was the first to answer. Good. It is xanthogranulomatous cholecystitis. Why this is xanthogranulomatous cholecystitis? What are the findings that made you write this? So there is mural thickening of the gallbladder and mural nodule also is there. Okay. Next one. This one. Answers, please. I have come to second spotter now. Who will type in the answer first? Let's see. Is anyone typing the answer? Type something. What are you seeing? What density is the lesion Marked at least. What density is the lesion marked there? Is it air density, fat density, fluid density? Very good, fat density. So it should be fat, fat plus oma. What is that? What is the tumor containing fat we call? Lipoma. It is pseudolipoma of Glisson's capsule. Okay, good. Good that you are attempting. See, since you attempted, you are coming close to the answers. Okay, now this one. I think the students will write the answers for this. Come on, try, people, attempt. What is it? It is no, not metastasis. Good. Yes, very good. It is scoliosis hepatis. What happens there? It is basically the dilated sinusoidal blood filled spaces. So they show enhancement and there'll be stasis of blood. So it on the portal venous phase there'll be a slightly hyperretenating, and wherever there's stasis of blood there'll be hemorrhage, calcification. And but this scoliosis hepatis will not cause any mass effect over the surrounding structures. Okay. Next portal. This everyone will write, I feel. Pseudocyst. Where it is extending to? Why did I give the first image? Yes, it is mediastinal pseudocyst. This was the hint was there was pseudocyst in the pancreas also, and it is extending up to the mediastinum. Okay, good. This one, very good. This is emphysematous pancreatitis. Yes, there is air in the pancreas. Okay, next. What is this? Very good. Emphysematous cholecystitis.
Ma'am, audio is not audible.
Okay, let's continue. I'm sorry, there was a problem with the network, I think. This is hepatic hydatid. Good. This is water lily sign, where we see the undulating membrane of the endocyst. Seven spotter. Yeah, I'll go back. This one, what is this? Have you typed? This is biliary cystadenoma. Correct. Okay. This one, let's see who will get it right without clues. Any idea? No. Look at the pancreas. Look at the pancreas. Is the shape normal? Yeah, it is bifid tail of the pancreas. Very good. Also called as fish tail pancreas. Good. Next. This one? No. Again, focus on the pancreas. We'll try if we can get it right. Yes, this is pancreatic lipomatosis or diffuse fatty pancreas. Fine. Okay. Next one. This one. Did anyone get it right? Abhishek, Harshini, Sumita. Good that you're all trying. Mallory Ways. Boerhaave's. Very good. It is Boerhaave's. Because we are seeing the leakage of contrast through esophagus. And what are we seeing here in the first image? This is pneumomediastinal. Okay. Someone already jumped to the no. Okay. This one, little difficult, but can try. Yes, very good. Which volvulus? There are so many organs in the abdomen showing volvulus, right? No, not cecal, not sigmoid. Anything else left? Not midgut. Come up. Gastric volvulus it is. Okay. This one? HSV, no. Multiple longitudinally oval filling defects because of the plaques. Candida. Very good. This is Candida. Fine. This one? If we answer fast, then we can cover more spotters. TB, string. Okay, string sign. Where it is seen? String sign of Cantor. Crohn's. Very good. Next, this one. Complete abdomen is replaced by what? Liposarcoma. This is diffuse intra-abdominal lipomatosis. Good that at least you have come close to the answer. See, you are already coming close to the answers because you are all trying. This one? Soumya, yes. Abhishek, Sumita, Abhishek, carcinoma, no. Can you think more benign? Can you think serpinginous varices? Very good. Serpinginous filling defects suggestive of varices. This one, now you can think more malignant. This is linitis plastica. It is stomach is not able to distend with the contrast, right? And there is loss of the mucosal pattern, linitis plastica. Okay, fine. This one, line. Which line? Suggestive of what? Hampton's line. Very good. Hampton's line is due to the overhanging mucosa seen in benign ulcers, especially in the profile view. Good, good, good. Very good. This one, let's see if anyone gets it right. Cardian, not actually. This is actually pneumatosis cystoides coli. Okay, there'll be a gas-filled cystic-like lesions in the wall. The cause is unknown. Last spotter, hiatus hernia. Yes, very good. Again, the answers. I think we have already discussed all this. Fine. Okay, now this is the riddle time. Let's see who answers this. I am unstoppable, but I am easy to waste. What am I? Something different from radiology. Time. Oh, wow. So many answers I'm getting. Very good. Very good. Okay. So, students, ready for the second set? Okay. Time. Correct. Second. Okay. Take your papers now. Start writing. I've started the timer. First spotter. Second spotter. Third spotter. Fourth one, focus on the marked part. What is that? Where it is ending? Where it is coming from? How long it is? Fifth one, how is the appearance and where it is seen in? Sixth one, sign and where it is seen. Next one, the next spotter. GI is all about the contrast, where it is filling, where it is not filling, where the contrast is going, where it is leaking, where it is communicating. Ninth spotter, the spotter is changed. Tenth spotter, focus on the marked area. 11th spotter, correlate both the images. 12th spotter, what is happening? Look at all the three images and correlate. Next spotter, 13th. Fourteenth spotter. Fifteenth spotter. Okay, we are done now for this set. So, time to discuss the answers now. Okay, students, you're ready with your answers? Start typing. What is this? Where is the lesion? Is it in the liver or outside the liver? Is it in the peritoneum? Yes. Someone has already typed intraperitoneal hydatid. It is peritoneal hydatid. Very good. Because it is showing, it is like multiloculated cystic lesion showing peripheral calcification, and it is seen in the peritoneum. It is not there. It is not in the liver. Okay. Next spotter. Very good. Who answered? Soumya, Sahil, Abhishek. Very good. I'll call out the name so that you will feel motivated to answer the next questions. This one, what is happening? Is there filling defect or is there ulceration or what? No, it is not CMV. Think of the colon causing, actually, they are ulcers, but they give the pseudo appearance of pseudo, pseudo, pseudo polyposis. Yes, good. It is actually mucosa ulceration leading to pseudopolyposis seen in ulcerative colitis. Very nice. Very good. Very good. Next, who got the pseudopolyposis? Soumya. Soumya, good. Sumita, very good. Ulcerative colitis. Okay, next. This one. You people were answering no? No. For the gastric volvulus, you were answering no? This is midgut volvulus. This one, Meckel's diverticulum. Okay. What is the rule of two? Okay, it's difficult for you people to type. I'll only say it is seen in 2% of the population. It is seen in less than the common age of presentation is 2 years, and it is seen 2 feet away from ileocecal junction. Okay, and it is 2 inch long, and it has two-third of them present with ectopic mucosa. There will be two types of ectopic mucosa. Okay, fine. Next. Yeah, this is intersusception. Very good, Abhishek, Sumita. And appearance, yeah, it is coil spring, not stack of coin. Good, Abhishek. Next, this one. Yes, this is hypertrophic pyloric stenosis. Very good. Oh my God, so many answers I am getting. Very good, people. This one. Appendicitis, no. Yes, the pathology is in the appendix. Very good. This is mucocele. How do you say that it is a mucocele? There is curvilinear intramural calcification. Okay. Next. This one. I think I missed one. Yeah, this one. Gastric diverticle. Very good. Very good, Abhishek. Next one. What is this? Lipoma. Where it is? Where it is? Where is the lipoma? In the peritoneum, liver, stomach. Where? It is gastric lipoma. Correct. You have to write it completely. I can understand that you are in a hurry to write the correct answer, but please try to write it completely. This one? This I think you will answer. Yes, these are collar button ulcer, seen in ulcerative colitis. Sumita, very good. Abhishek, good that you have attempted. This one, GI is all about twisting and turning. This is sigmoid volvulus, coffee bean appearance, right? What is the difference between sigmoid and cecal? Sigmoid starts from the left lower quadrant. Cecal starts from right lower quadrant. And sigmoid is a haustral. Cecal is haustral. And sigmoid will not cause the distal bowel, the sigmoid will cause the proximal large bowel obstruction, whereas the cecum, in the cecal volvulus, the distal large bowel loops will not be dilated. Okay, whirlpool sign. Okay, good. Next, this one. Look carefully. You will be having two things in mind when you see these images, but you have to come to a conclusion. What is this? Whether this is that pathology or this. So you have to look carefully. Where is G junction? Yes, this is epiphrenic diverticulum. This is not sliding hiatus hernia. Why? Because gastroesophageal junction is at the normal location. Only there is diverticulum in the from the esophagus in the epiphrenic location. Good. This is epiphrenic diverticulum. This one, scleroderma. What sign? What sign this is? Hide bound sign. Very good, very good. Have anyone thought what is the meaning of hide bound? When the skin is completely tightly attached to ribs, no? So that is called hide bound. So this looks like that. This one, what is this? Mesenteric cyst. Okay, good attempt. Can do better. Some tumor which contain, yes, very good, lymphangioma. Before giving hint only, you're all typing the right answers. Very good. This is lymphangioma. Multiloculated cystic lesion. This one, the last quarter for the set. Before we jump into the riddle, carcinoid. Okay, this is sclerosing mesenteritis. Okay, we are done for the second set. Good students, you're all answering very nice. Same answers. We have already discussed this. We'll skip this. Riddle time. What is astronaut's favorite key on keyboard? Space. Very good. Tech guessed it right. Guess Tech was the first person to guess it right. Very good. Vidhi, Dr. Soumya, very good. Okay. Space is the correct answer. Okay, ready for the third set now? Take your papers, start writing the answers. Set number 3, I'll be starting the timer. Okay, here we go. First quarter. For this, I want complete answer because I know most of you will guess it right, but I want the complete answer. Second quarter. Third one. By now, you might have realized that we are concentrating on genitourinary system in this set. Fourth quarter. Fifth quarter. Sixth quarter. Seventh spotter. Eighth spotter. Ninth spotter. Just see if all organs are at the normal place or not. If not, think whether it can be congenital or post operative. If post operative, then why is that pathology seen? Is it related to the surgery? I have given enough of hints, I think. Next spotter. Next one. This one. 13th spotter. Fourteenth spotter. Last spotter for the set. We have two more spotters. 16th spotter. 17 spotter. Focus on the marked area. Okay, we are done. Okay, students, are you all ready with the answers? Let's begin. First question. What is the answer for this spotter? I want complete answer. Unilateral. Is it unilateral? Grade 6. How many grades are there? How many grades are there? 5. Which grade is this? This is bilateral grade 5 BUR. Very good. Harshini gave me the right answer. Okay, so let's discuss with the grades of vesicoelectric reflux then. Grade 1 is into the. Okay, I'll ask you people only then. Better. Grade 1 is what? Reflux into ureter. Good. Grade 2 is reflux into pelvis. Very good. What is grade 3? Is it mild, moderate, or severe dilatation? Grade 3 is mild dilatation. Grade 4 is moderate dilatation with preserved papillary impression. Grade 5 is severe dilatation. Okay, very. Next, spotted. This one. What is this? So since we are dealing with the okay, someone already answered. Abhishek, good. Striated nephrogram. Where all it is seen? Striated nephrogram. It is seen in pyelonephritis. It is also seen in many other conditions. I'll just show you the slide so that we can study together. So it's already, there are like unilateral and bilateral striated nephrograms. Unilateral is seen in acute ureteric obstruction. So if there is any calculus causing the ureteric obstruction, that time also you can see the striated nephrogram. Also seen in acute pyelonephritis, renal vein thrombosis when there is no proper drainage of the blood, and then acutely following the renal contusion. Okay, and also acute radiation therapy. Bilateral nephrograms are seen in ARPKD, acute pyelonephritis, acute tubular obstruction, necrosis, hypotension. Okay. Next. Third spotter. What is this? Wanderlust. It is Wonderlick. Wonderlick. Very good, Abhishek. Where it is seen? AML. Yes, it is angiomyolipoma with hemorrhage. Good, very good. Abhishek, Sumita, very good. You're all participating very actively. This one? Try learning the spellings also, okay? You have to be perfect with your spelling also when you write the spotters in the exam. Retroperitoneal fibrosis, very good. Trishla, Dr. Yes, Sumita, very good. So why are you saying that it is retroperitoneal fibrosis? What are the three things you are looking at before calling it as retroperitoneal fibrosis? Medial ureteric deviation. Yes, the mid ureter will be deviated medially. What is that sign called? Maiden waist sign. Yes, okay. And then distal ureter will be, there will be tapering of the distal ureter. And then the proximally there will be dilatation of the pelvic calyceal system. So this is retroperitoneal fibrosis. Okay. This one, retrocaval ureter. Very good, very good. Here we can see the ureter is behind the inferior vena cava, causing obstruction and thus dilatation of the proximal ureter and pelvic calyceal system. Very nice. This one, adrenal myelolipoma. We are at the level of kidneys and it is not air. Air is here. See, this is the air within the bowel. This is not the air density. Xanthogranulomatous pyelonephritis. Xanthogranulomatous will be seeing beer paw sign, right? We are not seeing that sign. Here, renal parenchyma is replaced by fat. Okay, so this we call as renal replacement lipomatosis. Okay, fine. At least you people are attempting it. Good. This one, no, this is not Erding-Chester. Page kidney, no. Lymphoma, yes, you are very close. This is renal lymphangiomatosis. Very good, Abhishek. Finally, you all reached. See, because you are attempting, you are getting closer and closer to the final answer. This is bilateral renal lymphangiomatosis. Very good. So, my warm up dose of motivation has helped everyone to reach the right answer. Very good. I'm happy. Next slide. This one. Where is the abnormality? Vast difference, no? The anatomical location is not of the vast difference. Yes, it is in the scrotum. So, what is there? Calcification is there in the scrotum. So, okay, peronis. And can you think of any other condition which causes calcification? Scrotoliths. Okay, what else will be there in the scrotum? Some dilated vascular spaces. We call it as, no, dilated vascular vessels causing the hyperdensity, varicocele. Okay, varicoceles are basically veins. And when there is calcification in the varicocele, what do we, phleboliths. Very good. Dr. Soumya got it. Varicocele was pampiniform veins, varicocele. Wow, very good. You people are right. So this is phlebolith of varicocele of pampiniform plexus. So all of you, like four people's answer together is the right answer. This is this. Okay. This is phleboliths of pampiniform plexus varicocele. Okay. Next. This one. Let's see if anyone guesses the right answer without me giving any hint. So I'll count 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. No answers without hint. Okay, let me give you the hint. Where is the kidney? Is it in the right location? Where is the kidney? Where is the right kidney? RIF. So this is not. Yes, someone answered already. Post renal transplant is very good answer. Tech. I don't know who is the tech, but very good. But it is half right. Post renal transplant is okay. It is not gossipioma. What else can be there? Urinoma. Okay, possible. Some seal. Very good, doctor. Yes, this is lymphocyte in a post renal transplant patient. Very good. Next, this one. RCC. Look at the vertebra. Are they mature? Is it an adult or child? Wilms. Okay. Wilms. Something else. Solid enhancing tumor in a pediatric age group. Mesoblastic nephroma. It is mesoblastic nephroma. Next, this one. Medullary sponge kidney. Medullary nephrocalcinosis. This is very good, Harshini. Very good, Abhishek. This one. Where are both the kidneys? Pancake? No. Ectopic malrotated? Yes. Ectopic malrotated. I want complete answer. Cross-fused ectopic kidney. Very good. This is cross-fused ectopic. Who answered it right? Trishla. Very good. Next, this one. Epidermoid. Which organ are we imaging? I want complete answer. Testis. Testicular Harshini. Very good. That's how the answer should be. It is testicular epidermoid. Very good. Other people also very good for attempting. Why? Because it is showing onion peel appearance. Yes. This one. Ectopic kidney. Very good. Where is it? Where is the kidney?
Ma'am, your voice is not audible. One second, ma'am. Which name is not coming? Ma'am, which name? Yes, ma'am. Try, ma'am.
Yeah, fine now, fine. Did someone type the answer? This is hairy kidney sign. Where do we see? Erythematous. Very good. And one more sign. What do we see here? About aorta? Coated aorta sign. Very good. Okay. This one?
Microsoft just announced their Majorana 1 font.
Yes, this is bladder extrophy. Very good. Next. How do you say that there is bladder extrophy?
Majorana 1.
Anyone answer? How do you say that this is bladder extrophy? Sahil wants to know. Yes, there is widening of pubic symphysis. This is also called what sign? So it's homework for you people. You have to find out the sign. Next one. This one? Yes, this is Manta ray sign. Very good. Very good. This is intraperitoneal rupture of urinary bladder. Why intraperitoneal? Yes, there is leakage of contrast from the bladder into the in between the bowel loops. So this is intraperitoneal and not extraperitoneal. It's very important to differentiate between intra and extraperitoneal rupture of urinary bladder. Okay, we are done with all the three sets of spotters. Kapil, I'm done with the spotters.
Okay, thank you, ma'am. Thank you, ma'am, for this wonderful session, ma'am. Hope the students have learned a lot today. So, students, we are left with one more session tomorrow at the same time. So, we will be sharing the presentation with you tomorrow and the video recording also for the candidates who missed the session today. So, good night, everyone.
1 second, Harshini, I think Dr. Soumya has answered that. That is phleboliths of varicose. Okay, thank you all. It was great time with you all. Good night.
Thank you, ma'am.